We developed a verification check about 3 or 4 years ago to reduce the risk of patellofemoral instability, and it was effective at doing so to less than 0.1% in the last 4 years. Careful positioning of the entrance of the drill hole reduces the risk of flexing the femoral component. This is the key step. So we don't use a rod that goes up the intermedullary canal because we want to have the ability to adjust the VV position of our distal cutting guide. So we drill our drill hole for the positioning rod perpendicular to the distal joint line and only go in about 10 centimeters. So we want to have the orientation of this drill hole to be such that it's centered in the shaft of the distal femur, anterior posteriorly, as you see here. And the verification check is the presence of a 5 to 10 millimeter bone bridge between the apex of the notch after osteophytes are removed and the posterior boundary of the drill hole. The simple verification check that reduces the risk of flexing the component is shown here. So we felt the top of the notch, the anterior cortex, we're drilling perpendicular, and we can actually feel the drill go in and graze the anterior cortex. Here's our verification check. The bone bridge, in this case, it's about 6 millimeters. Careful positioning of the entrance drill hole reduced the risk of flexion, as shown in this paper by Ettinger, where a positioning rod and a patient-specific guide were compared to see which method reduced the risk of flexion of the component. The use of the positioning rod and bone bridge verification check limited the mean flexion of the femoral component to about 1 degree plus or minus 2, so a very small variability and a very narrow range. So we measured this with a line placed 12 centimeters proximal and 5 centimeters proximal and bisected and put our longitudinal axis, and in this case you can see 1 degree of flexion. The use of an anatomic and not a dome patella implant is effective at maximally covering the patella, which reduces the risk of overgrowth with soft tissue. This also allows more surface area for congruency within the prosthetic groove. This can be done without a lateral release. In all of the total knees we do, we'll only do a lateral release if someone has a chronic dislocation of the patella. If they've had a history of chronic instability, simply restoring the native alignment can often make these patellas track quite well, since you're providing a trochlea that has a cavity, which is usually missing in these patients with severe patellofemoral arthrosis and lateral facet hypoplasia and chronic dislocation. Now, one of the things we can do to try to further reduce the risk of patellofemoral tracking is to redesign the femoral component for explicit use with kinematic alignment, and if we do so, we should strive to increase the lateral coverage of the distal femur. The anatomic rationale for designing the prosthetic trochlea for kinematic alignment can be seen in these examples, 2 different distal femurs, where the existing femoral component designed for mechanical alignment is positioned using kinematic alignment. And what you can see in the outline in red, which was the resection plane, that the mechanical alignment prosthetic trochlea uncovers the lateral femur. So if we can change the shape of the prosthetic trochlea to extend more lateral, and as I'll show in a moment, some minor deviations from the current existing groove location, this can maybe more optimize our femoral component for kinematic alignment. So the newly designed kinematically aligned prosthetic trochlea, when superimposed, markedly covers up that lateral ridge, and this increases the ability of the prosthetic trochlea to capture the patella as the knee is flexed. A biomechanical rationale for redesigning the prosthetic trochlea explicitly for kinematic alignment was derived from this study performed in our lab, where we looked at kinematic alignment and showed that it more closely restores the groove location and the sulcus angle of the native trochlea than mechanical alignment does, and this provides some implications for prosthetic design. So if we look at this, a little complicated slide, but at the top you can see we investigated the Persona, the Next Gen, the Vanguard. On the Y-axis are a variety of dependent variables: medial lateral location of the groove, radial location of the groove, sulcus angle, and we did this on 10 three-dimensional models of native femurs, and we discovered that just small modifications that change the medial, lateral, and radial locations of the groove and sulcus angle are strategies that can be used to more closely restore the native trochlea and perhaps more optimize a redesigned femoral component for use explicitly with kinematic alignment.